My name is Ariana Demers. I'm a second-year grad student here at Texas University, and today I'm going to be showing you guys the Mulligan technique. So basically, some indications of the Mulligan technique is number one is pain. If the patient has any pain, decrease in like range of motion or any kind of abnormal arthrokinematics. Some rationale why we would use this technique is because if the patient has any kind of postural deficits, then we'll use this. As well as with the pain side, we're basically just going to increase some afferent action so we can decrease some of those nociceptions so we can decrease the pain. So basically, first off, how you want this, you want your patient to basically just be kneeling on one knee, and then whichever side is affected, have basically the strap around their malleolus level and have some comfortability right here. And then I will go ahead and just strap myself in. So today we're going to be doing the Taylor Mulligan technique. So basically we're just kind of increasing some of that dorsiflexion that the patient has any decrease in. So first off, with your hands, you want to come in into kind of the talar web, and you just want to kind of push towards the talus. And then you're going to ask your patient to slightly just lean forward as you're pulling on your back with the strap with an anterior force. And back. Good. And when you first start off with this, you want to start off with about sets of 6. And then as they progress through, we'll just do about 3 sets of 10. And then this will basically just help with the increasing in range of motion. So right now we are going to be doing the muscle strengthening technique, specifically the eccentric contraction. So we'll use the bicep for example. The reason why you would use this technique is because, first of all, with eccentric contractions, you're lengthening the muscle. Also, as well, you are creating more tension in the muscle. So you would typically use this more in like early onset of rehab. So for example, you'll have your patient just kind of sit upright and then have their arm pretty much just kind of relaxed. And basically take the weight. Perfect. And basically they're just going to do a bicep curl, just like normal. But when they come down, they're going to go nice and slow, keeping that contraction. Typically you're going to do this about 2 to 4 seconds. And back up. And you would typically start off with like sets of 8 or something like that. And then as they progress, you would do more sets and reps. So about 3 sets of 10 reps.
Hi, my name is Casey Harrell and I'm a student here at Texas University. Today we're going to be doing the Maitland mobilizations for the patella. One reason that you could do this is if the patient is right out of knee surgery. This is going to help to decrease scar tissue as well as adhesion and increase range of motion. So for grade 1, you're going to move the patella just slightly, not outside of the joint area. And this is going to be to control pain and spasm. For grade 2, you're going to move it a little bit more, still not outside of that joint area, and this also is for controlled pain and spasm. For grade 3, you're going to move it, stretching that joint capsule, but not too far. And now this one is going to be for stretching, and grades 1 through 3 are you're going to do for 5 to 10 minutes. Now grade 4, you're going to move all the way out to that joint capsule and start oscillating for 1 to 2 times per second for 1 to 2 minutes, and now this is going to be for stretching.
Hi, my name is Julia Garcia and I attend Texas University. Today I'll be focusing on PNF stretching, which the main focus of PNF stretching is to increase coordination, flexibility, and strength, and it's also to re-educate the motor units. So today I'll be focusing on the hamstring, and the first one we're going to do is a slow reversal, hold, relax. So basically I'm going to pick up her leg as far as she can go until she feels a stretch, and then she's going to slowly push my hand downwards, and once I hit the bottom, she's going to bring up her leg by herself as far as she can, and then we're going to repeat the process. And you repeat this process 3 times for 5 to 8 seconds, and then on the 4th try, you're going to do a hold of 10 seconds. On the second stretching technique, it is called the hold relax. Basically, I'm gonna push her leg all the way up until she feels a stretch. I'm gonna push forward while she's pushing back, And for 3 reps, we're gonna do 5 to 8 seconds. And on the 4th, we're gonna do a hold for 10 seconds. On the 3rd stretching technique, it's called contract relax. I'm going to push her leg up until she feels a stretch. And then she's gonna gradually push down on my hand. And then I'm gonna passively push it back up. I'm gonna repeat the process for 3 times, 5 to 8 seconds. And then on the 4th time, we're going to do a hold for 10 seconds.